Hi, guys. I hope you're doing good. So, as you already probably know, I'm looking at, you know, another surgery on my knee. And like I told you guys before, my other surgeries, I kind of rolled with it. I was always scared just before going into the OR and being in the OR. I kind of freak out. I ain't gonna lie. They have to medicate the hell out of me, especially if it's going to be a little bit before the surgeon comes in. Which is not a good idea to put the patient in there and then wait and wait and wait and wait and wait. You know what I'm saying? Like, that's just gonna exacerbate their anxiety, which should be common sense. Um, so anyway, what happens before surgery? So, like, it's starting to come back to me. It's starting to flood back to me what I had to go through because I've been through this a lot. So, my personal experience and what I went through, probably similar to everybody else. Each hospital probably has a different protocol. I don't know, or a similar protocol. I wouldn't know. But University Hospital, pretty much, or MOI, wherever you're having your surgery done around here. Um, so they schedule it, and then eventually you will get a phone call from the nurse, and they do basically a questionnaire on the phone. They do it every surgery. So it's not like they do it once and it's done. They do it every time. You know, uh, do you have any problems with anesthesia, either going under or coming out of it? Are you allergic to anything? What are you allergic to? Have you had complications before surgery? What types of complications have you had? Do you have any lung issues? Do you have any metal in your body? Just things like that. They do like a little survey with you on the phone, or pre-surgery survey. Then one you'll have to do well, what I'm just going to go by what my experience is, because like I said, people may have different experiences. But then what happens is I had to go in for my pre-surgery testing. So you have to have blood drawn because they're vampires and they love taking your blood. I'm so bad. I need to put myself in timeout. No, but seriously, they do have to do blood work. They do an EKG to make sure that my heart is strong enough for surgery. They do a chest X-ray to make sure there's no complications with my lungs. And I think that's it. EKG, blood work, chest X-ray, and then pretty much all set for surgery. The survey's done. The pre-surgery testing is done. And then it's just a matter of waiting, okay? The night before, these are things that they don't want you to do, okay? Especially for women. They don't want you shaving the night before surgery, because any open wounds on your body, even if it's something you don't even know that it's a cut or whatever, can lead to possible infection. So, you know, they don't want anything that's going to put you in any type of risk whatsoever. And your skin is a window or a door. So if something is open, it lets things in. And the last thing you want is an infection when you've just been cut open. It's just complications. So they don't want you to shave prior. They do want you to shower with let's see, it's like a antibacterial soap type of deal. I forget what it's called, but they ask you to get it and bathe in it. It's like antibacterial the night before, the night of. And then when you get to when I got to the hospital, you got to get there way early. So they can, get your IV set and, put your IV in. And what else? Oh, you have to, I had to bathe myself. It's like, They use these multiple pads, these thick pads that are also antibacterial in this sealed package. You open the package and you wipe each part of your body with a separate cleansing thing, moist thing. It's like antibacterial stuff. So, like, if you wash one arm, you just use for one arm. Use another pad for your other arm, one for your torso and your back area, another one for your one leg, and another one for another leg. So you don't you use the whole all each pre-soaked pad thing. And then they give you some socks. They don't want you wearing your socks. They want to give you theirs. They'll get you some socks. If you wear glasses, they'll give you, try to remember to bring your eyeglass case. If not, they've got one usually at the hospital for you. Um, let's see. And then it's a matter of waiting. And, and then surgery, and then hopefully on the road to recovery, no complications, and boom, ready to roll. I strongly suggest this. Oh my God, I cannot emphasize this enough. This is a huge mistake that I have made before. I'm not making it again, okay? Huge, massive mistake that I made. They give you, you can either get the medication filled, the script filled at the hospital pharmacy, or you could get it filled at your regular pharmacy. Well, I made a mistake of, I wanted to go to bed after surgery. I'm tired. My body just went through a lot. I want to go to bed. And I didn't get, the one time I didn't get my medicine until the next day. My God, was that a mistake, a mistake, a mistake, a mistake, because I had the impression that I'm going to be standing in line forever at Walmart waiting on my, at the pharmacy, waiting on my medicine. That is not true. So what you do is you call them, if just in case they're busy or whatever, you call them and you say, listen, I had surgery today and I need my pain meds as soon as possible. How soon can I get them? And they will get those to you right away, because they know that once that anesthesia wears off, yeah. So you don't want to wait until the medicine wears off, because the pain's going to kick in hard, okay? So you want to stay on top of those medications, and you do not want to skip it until later that day, or I'll pick it up tomorrow. Oh God, no. No, 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 no. No. It's not something you want to sign up for. I'm telling you from experience, you don't want to do that. So, and then, like I said, just a matter of waiting. But once I get notified that surgery's, you know, ready to go, and I mean, we're waiting, I will get all my pre stuff done as soon as I possibly can. Let's get it knocked out like now, because it's not something you really look forward to. So let's just get it done. Um, yeah. And then the day of, you just get there super early, because you have to be signed in. You got to go to pre-surgery and sign papers and consent forms, and a lot of it is waiting and waiting and waiting. My friend came with me, but he wasn't, when they finally pulled me back to my room, he's not allowed to come back there until they get the IV in. Why? I have no idea, but that's just how they do. I don't know why, but they do. And then once my IV's in and I've done my pre-surgery cleansing on my body, antibacterial on my body, um, then he's eventually allowed to come back there. So, let's see. One thing that you do not want to do also is use antibacterial soap in your private area. That's a no-no, because the hospital antibacterial is so powerful that you really don't want to put it down there, because you'll irritate the absolute hell out of your skin. So they will tell you, do not use it down there. Just use it on your arms, your neck, your torso, stuff like that. But do not use it on your private area. Um, Antibacterial, especially for women, antibacterial down there is bad. It's just your skin is so hypersensitive and can get raw easily, and you just got to be super careful with that. Um, yeah. So that's pretty much it that I can think of. Yeah. And like all of this started coming back to me because we're looking at another one. So like all of a sudden I remembered all these tidbits of information of things that you have to do prior to surgery, while you're waiting, after surgery, and all this. But there's a lot of prep prior. And I think like one surgery, um the night before, I had a candlelight bath, and I listened to some soft music while I was soaking in the bath, just because it's soothing. I'm trying to put my mind in a relaxed state. And then the morning of, gotta be at the hospital so early, it's usually dark out. Even in the summer, it's dark out. So, you don't really have time to be nervous because you're getting up, you're getting showered, brushing your teeth, do whatever you're gonna do with your hair so it's not in the way or whatever, braid it or pin it up or whatever you're gonna do. Um, and, dealing with the traffic on the way to the hospital. So you don't really have time to be nervous. And then it's a lot of waiting and talking to everybody before surgery too. Sorry, I'm going backwards. You're gonna talk to a bunch of people before surgery, and you're gonna talk to the anesthesiologist and the nurses, and all these different people, and they're gonna tell you the procedures. And it's a teaching hospital. University is a teaching hospital, so I remember one surgery. Oh, the surgery for my back. A bunch of students came in when I was still out of it, and I opened up my eyes and I said, wow, that's a lot of people. So the person who I guess is their instructor or their, I don't know, a doctor who's, I don't know who the person is, but they're in charge. Okay. And they said, "Do you want them to not come in?" I said, "No, that's fine." It's a teaching hospital. They have to learn, right? So the more experience they get, the better they become. So don't refuse them, let them come in. It's just for learning. It's not for gawking or for making a video of your demise. Oh, look what happened to this person. It's not for that. It's for teaching. So they have to be exposed to whatever, as many things as possible so they can learn. Okay. If you have any questions, let me know. And I see my doctor June 1st, and chances are we'll schedule that day. And any questions that I have, we will discuss it that day. And everything that I learn, I will talk to you about. I will teach you and educate you on what we're going to be doing and when and all that good stuff. So, yeah. Anyway, love you guys. Take care.